Hey, Dr. Proctor here from Beltline Health. We're here today to talk about bariatric surgery and specifically what is the sleeve gastrectomy. I have a lot of patients that come to me and they say, Dr. Proctor, I've done my research and I really feel like the sleeve gastrectomy is right for me. And we kind of delve into things and I get all kinds of crazy explanations as to what they think a sleeve is. Most commonly, people think there's some sort of implantable device or sleeve that we're putting around the stomach. Gastric sleeve, which is a terrible name for this operation, by the way, is an operation where we're actually removing about 3/4 of the stomach, going from a large sort of distensible or stretchable stomach down to a very narrow, high pressure tube of a stomach. We've been doing this now in the United States for a little over a decade. And the initial thought was, well, if I just reduce the size of your stomach and I leave part behind that's not very stretchy, then you won't be able to eat much food, and that's what's going to allow you to lose weight. More research over the last several years has shown us that while there is some restriction involved with this operation, it's the removal of that portion of the stomach that kicks off this metabolic phase that we always talked about, where patients' bodies want to readjust or reset how much weight they're carrying around. So a sleeve gastrectomy is a good way to go about that. What are the upsides of the sleeve gastrectomy? Well, it's an operation where we're just operating on the stomach. We're staying away from the rest of the small bowel. There's no intestinal bypass that goes along with this operation. So patients are going to absorb 100% of what they're eating or absorb the same amount as they would before they had surgery. So that's a good thing with respect to not getting vitamin deficiencies and malnutrition and things like that down the road. But it can also be problematic because when patients start eating things they shouldn't be eating, again, they're going to absorb those things, which is why we probably see a little bit more weight regain with this particular operation than we would with a traditional gastric bypass or a duodenal switch. So you really need to be careful, as you would with all the procedures, with how you're eating afterwards. This operation also does carry with it a little bit higher reoperation rate. What do I mean by that? If I do a sleeve gastrectomy on you today, there's about a 17% chance that I'm going to need to operate on you within 5 to 10 years, either because of weight regain or patients who have developed gastrointestinal reflux or heartburn or GERD from this particular operation. So things that we need to be really closely watch. Make sure the patients don't regain their weight, make sure they don't develop this GERD, and if they do, if we can't manage it medically, then sometimes we do need to reoperate on it. Outside of that, it is a wonderful operation. It's an operation that can easily be converted to a more aggressive operation like a gastric bypass or a duodenal switch down the road should weight regain occur. These are things that aren't quite as easy to do after the other operations. So it's a good entry-level operation and really good for younger folks who have a long life to live and can get into some dietary issues down the road where they may see some weight regain. So love to talk to you more about this. If you're interested, please check the link down below to look into talking to us and make an appointment. Thank you very much. Be sure to subscribe to our channel and we'll see you soon.